help them manage their health and live their healthiest life. We are now going to hear from Jeff Smith, who is going to share with you information about the Stanford Self-Management Program. Jeff?
Great. Thank you, Ashley. So again, my name is Jeff Smith. I've been at Qualis Health for a little over 1 year. I'm the lead quality improvement consultant at Qualis Health for the diabetes care program in our Medicare contract, which started in July 2014. I'm excited about this opportunity to share with you for a few minutes about the diabetes self-management developed by Stanford, and specifically here in Idaho. But first, a little bit about Qualis Health. Qualis Health has been in Idaho for about 30 years. We are a leading national population health management organization. Qualis Health is the Medicare Quality Innovation Network, Quality Improvement Organization for Idaho and Washington. The QIO program is one of the largest federal programs dedicated to improving health quality at the local level. In short, I like to say that we are contracted by Medicare to improve health outcomes for seniors. So with this first slide, I'm going to share the impact of Medicare patients with diabetes have on emergency department visits, hospital admissions, and readmissions compared to those patients without diabetes in Washington and Idaho. So this data and infograph was provided by our Qualis Health Analytics team and our communications team. Again, this is just for Medicare patients, so compared to patients without diabetes, ED visits are 83% more in Idaho and 85% more in Washington. Hospital admissions are 147% more in Idaho and 156% more in Washington. And then 30-day rehospitalizations are 245% more in Idaho and 258% more in Washington. So these are pretty similar with both states, pretty similar numbers, but the numbers show a great need for resources in diabetes prevention, education, and self-management. Unfortunately, our analytics team also provided data that shows that diabetes self-management education and nutritional therapy or training is extremely underutilized, less than 5%. So my objective for today is to give a brief overview of the Stanford Diabetes Self-Management Program, or DSMP. Number 2 is to share how this program is doing in Idaho. And last is to discuss opportunities for partnerships and cross-referrals between providers, self-management programs to strengthen and grow diabetes prevention and self-management. So first, the Diabetes Self-Management Program is a fun and interactive program. It's an evidence-based workshop developed by Stanford University's Patient Education and Research Center. The program developers of the program are Dr. Kate Lering, Virginia Gonzalez, Frank Villa, and Katie Plan and Diane Laurent. All these individuals worked at Stanford at the time the program was developed. The program has been reviewed by physicians, diabetes educators, dietitians, and other healthcare professionals both at Stanford and in the community. The original diabetes self-management program was first developed in Spanish. The successful outcomes were found with that program, which significantly improved depression, symptoms of hypoglycemia, communication with physicians, healthy eating, and reading food labels. They also had a significant improvements in patient activation. They didn't find any significant changes in utilization or A1C, but they determined that this is probably because A1C for the participants in their study was already within a desirable range. So this program is offered in every state in about 8 different countries around the world. In December 2016, the workshop curriculum was updated to align with recent changes at the American Diabetes Association. So the workshop is free, and there are no referrals needed. It is open to anyone, but it's geared toward people with prediabetes, diabetes, and family members or caregivers. Again, anyone's welcome to attend. We do set clear expectations at the beginning of the workshop, as outlined by Stanford, to foster success. We meet about once a week. Actually, we meet once a week for 6 weeks. Each class usually takes about 2 hours. Workshops are typically held in community settings such as churches, senior centers, community centers, libraries, housing authorities, clinics, and hospitals. We have learned that workshop recruitment is best done at the local level by a community leader or advocate. We need about 8 to 12 participants to start a workshop. And during the workshop, there's lots of sharing, brainstorming, small group activities. Workshops are facilitated by two trained leaders. Ideally, these should be peers or people with diabetes. Workshop participants are given a lot of self-management tools to use as needed. So some of these tools to help them with self-management of their diabetes include nutrition and menu planning, reading food labels. This is one of the class favorites that I have found. They're giving guidelines what to look for on food labels and find it quite educational. Number 3 is we cover safe exercise. We cover monitoring blood sugar and keeping it in balance, preventing high and low blood sugar. We talk about medication management, dealing with difficult emotions like stress and depression. We go through a muscle relaxation technique in class. We problem solve, do decision making, work on communication techniques, and working with our healthcare provider. We also cover topics such as foot care, what to do on sick days, positive thinking, and action plans. Action plans are also a class favorite, also one of my favorites, because for most people, making needed changes can be very overwhelming and confusing. They seem too big to do all at once. Action plans allow participants to achieve what they want by breaking it down into small, doable steps. Action plans are set and shared at the end of each class, and then they're reported on how well they did at the beginning of the next class, the next week. So action plans are something that you want or decide to do. This can be anything, but we encourage them to do something related to their diabetes management, but it really can be anything. Must be achievable, must be action-specific. For example, if somebody wants to lose weight, a good action plan might be, I'm going to walk for 10 minutes or avoid sugary drinks. The action plan should answer the following questions, such as what? For example, I'm going to walk, replace junk food with healthy snacks, or I'm going to read a chapter in the Living a Healthy Life book. It should also answer the question, how much? For example, time, distance, and amount. And when, for example, time of day, like in the morning, after dinner, things like that. And then how often? A number of times in the week. And we encourage them not to be too ambitious, that way they're successful. But also, we encourage them to have a confidence level of 7 or more. If their confidence level is lower than 7, we invite them to reconsider or maybe revise their action plan so that they're confident they can do it. This part of the workshop is where participants have an opportunity to take one thing they have learned and apply it during the week. The workshops leaders also make and report on action plans, so there's lots of opportunities for everyone to be successful. So during the workshop, we use some tools to facilitate learning. Each leader makes their own charts, as shown here in the leader manual on the right. Here are a couple examples. They also need to provide their own supplies and copies. The workshops are designed to be low-tech, so that way they can be offered almost anywhere. Leaders also provide a manual they use for the 6 weeks, or they're also provided in the manual. The manual lists out each topic, mini lecturettes, activities, and it makes it really easy to facilitate the program during that week. Leaders are instructed to closely follow the manual during the workshop to maintain fidelity of this evidence-based program. There are no outside speakers or materials, no promoting or selling of products or services by anyone. Although leaders are allowed and maybe even encouraged to provide a resource table in the back of the room where they can provide flyers and pamphlets for resources in the area. Participants also have an opportunity to share their own success and share with the class as appropriate. So workshop participants are provided a few things. So one is they're provided a handout that has the week and then also the topic that we're covering that week. And of course, a lot of the topics are repeated throughout the 6 weeks. They are also provided a relaxation CD for mind and body. It includes a progressive muscle relaxation and guided imagery. And they're also provided a book there, as shown. This book covers self-management, safe exercise at all levels, healthy eating, managing medication, what's a healthy weight, and diabetes, and so forth. So we have received a lot of positive feedback about the book and the relaxation CD. One workshop participant said that she has never heard the end of the CD because she keeps falling asleep before it's over. So I guess it really works. Again, there is no charge for these items. So in Idaho, we have been successful at implementing this program. The first DSMP workshop was offered and completed in Lewiston in February 2015. A year later, we had the second one in Idaho Falls, and now in 2017, we have momentum. We want to keep it going. So far, we have held 29 workshops for DSMP. The workshops, we have had 223 completers. Completer means that they have completed at least 4 out of the 6 classes. So they came for at least 4 weeks. We have nearly a 70% retention rate in Idaho. So far, most workshops have been in eastern Idaho, but again, we're growing and spreading the program throughout the state. We currently have about 20 active DSMP trained leaders throughout the state. An active leader means that they've taught at least 1 workshop in the last 12 months. There have been 7 workshops in the Treasure Valley, 1 workshop in the Magic Valley, and 20 in eastern Idaho. So here's a bubble map of Idaho where we have completers for the DSMP program. Again, we're striving to grow the program and reach more Idahoans. The tools and techniques and principles in this program are not only evidence-based, but they really work. I have personally tried them and have seen it work in others. This program has touched many lives. Contract with Medicare, we are collecting clinical and program data on workshop completers. A clinical analysis is being done by Medicare on 10% of workshop completers. And so we will look forward to hearing those results when the contract is over. However, based on our discussions and observations currently with participants, they are testing more, they're exercising more, they're eating better, they're reading food labels, they're supporting each other and understanding more about diabetes. One participant, for the first time in a very long time, could put on her own shoes. Her husband came in and said, "Oh, your shoes are on. You did it yourself." And that was very rewarding to hear that. Also, others, for the first time, they're understanding the appropriate amount of carbs that they should eat for each meal to keep their blood sugar in balance. So there's a lot of good things happening out there. Unlike most programs, this program does not work without strong partnerships. We support each other by referring, cross-referrals, promoting, hosting a workshop, even just attending, being a participant in a workshop or leading out or becoming a leader yourself. Here are some examples of some of our valued partnerships, and feel free to review that list. So we want to partner with as many people as we can to provide this free workshop to those with prediabetes and diabetes, especially to the more rural populations or populations at risk for diabetes and complications from diabetes. No one organization can possibly serve all patients with diabetes. No one program or treatment is suited for all participants. It's good to have a variety, and people benefit from hearing the same message from multiple sources and multiple times. Sometimes it takes a while for people to make a change. In summary, the DSMP, or the Diabetes Self-Management Program, is an evidence-based program developed by Stanford University. It is a 6-week program with 2-hour classes per week. The program is designed to complement and support the treatment participants obtain from their providers and diabetes educators. During the workshops, we always refer and encourage people to see their provider, dietitian, or diabetes educator. We do that frequently in each class. And also to be prepared for their appointments. So in closing, I will return to this slide on the impact that patients with diabetes have on medical services compared to those who do not have diabetes. Not shown here is also the personal impact that diabetes has on individuals and their families. Remember, even if you just prevent one person from getting diabetes, or prevent one complication, like a stroke or amputation, or prevent one ED visit, or one rehospitalization, it's all worth it. So what is the next step? Well, we invite you to partner or look for opportunities to partner with Stanford Diabetes Self-Management Programs in your area for cross-referrals, or also to provide this program at your organization. We post our workshops and the workshops of our partners on our website, and I will post that in the chat. We have only have a few on our website right now, but we're always adding more and plan to add more in the coming months. One of our partnerships uses their email system. It emails the flyers to their patients who have diabetes or prediabetes. There's lots of ways to promote the program and to get the word out. Second, you can also become a trained diabetes self-management program leader. Leader trainings are 4 days, all day for 4 days, but they're great and they give you a lot of good information on how to facilitate a workshop. Later this year we have 2 scheduled, and I can give you more information on that if you're interested. And third, you can explore obtaining your own Stanford Diabetes Self-Management Program license. Currently there are 4 Stanford licenses serving Idaho. There's one serving Lewiston, Boise, Pocatello, and Idaho Falls, but we're always looking to grow the program. So here's my contact information. I'm available to answer any questions you may have at the end of the webinar. You may also contact me for any technical assistance or questions you may have. Again, our workshops are listed on the link that I put in the chat. And thank you very much.